Recognizing the member from Vancouver-Langara.
Thank you, Honorable Madam Speaker. I rise today to express my support for the principle of this bill during second reading. The well-being of new and expectant parents as well as their families is a fundamental priority for our government. We recognize that perinatal and postnatal mental health is a critical aspect of maternity care, and I appreciate the intent of this legislation to strengthen supports in this area. As outlined, this bill proposes the development of a comprehensive strategy for perinatal and postnatal mental health in British Columbia. This strategy must ensure universal access to care, expand community-based services, increase awareness, and reduce barriers to care while also promoting research and addressing the social determinants of health. These are all objectives that align with the work already underway in our province. The Ministry's 2025-26 mandate letter already directs us to improve the delivery of maternity and reproductive care across the province. In support of this, we have made significant strides in strengthening primary care, which plays a crucial role in perinatal and postnatal mental health. This includes the expansion of the longitudinal family physician LFP payment model, ensuring fair compensation for family doctors providing maternity and newborn care in hospitals. On-call payments for facility-based maternity service providers through the Medical On-Call Availability Program. The 2022-25 Midwifery Main Agreement, which introduces new contract options for midwives and lays the groundwork for an alternative funding model similar to LFP. Team-based care resources through primary care networks and the Nurse in Practice program to increase maternity care capacity. Funding various maternity initiatives, including the Maternity Network, Maternity Care Risk Assessment, Maternity Care for BC, and the Maternity Care Grant through the Family Practice Services Committee. Supporting the Maternity and Baby Advice Line, MABAL, a 24/7 virtual support line for rural, remote, and Indigenous primary care providers offering maternal and newborn care expertise. Primary care networks are already advancing maternity and newborn service planning and development, ensuring that more families across BC have access to the care they need. Additionally, the ministry has prioritized culturally safe and trauma-informed care, recognizing that these approaches are crucial in addressing perinatal and postnatal mental health challenges. Further, we are making progress in enhancing specialized perinatal and postnatal mental health services. Individuals experiencing perinatal mood and anxiety disorders can access professional support through primary care providers, urgent and primary care centers, and health authority-led community mental health services. Specialized reproductive mental health services are available through BC Women's Hospital and select regional health authorities, offering comprehensive assessment and treatment through a multidisciplinary approach. We have also made targeted investments in substance use services for perinatal individuals. The Families in Recovery program at BC Women's Hospital provides specialized support for those navigating both mental health and substance use concerns. As of August 2024, there are 29 services specifically designed for pregnant individuals who use substances, including live-in supportive housing, wraparound community programs, and acute care beds. However, we recognize that there's more to be done to ensure equitable access across all regions of the province. Public access to mental health resources is another key priority. Community groups and nonprofit organizations such as the Pacific Postpartum Society offer in-person, telephone, and text-based peer support. Digital platforms including postpartumcare.ca and HealthLink BC provide individuals and families with reliable information on perinatal and postnatal mental health care options. Additionally, the Perinatal Mental Health and Substance Use Engagement Network has been established to improve services by incorporating the voices of those with lived experiences. We understand that timely access to mental health care providers, increased availability of training for healthcare workers, and expanded community-based services are essential components of a strong perinatal and postnatal mental health system. That's why Perinatal Services BC has developed the Perinatal and Newborn Health Hub, a clinical resource system offering evidence-based guidelines for each stage of pregnancy and newborn care. This hub ensures that healthcare professionals have access to the latest best practices, including mental health support during the preconception, pregnancy, and postpartum periods. Additionally, we have partnered with UBC to create training resources such as the Not Just the Blues Perinatal Depression and Anxiety online module, equipping providers with the necessary tools to recognize, screen, and treat perinatal mental health disorders effectively. Honorable Speaker, while we acknowledge that further progress is needed, I want to emphasize that our government is already actively working on these priorities. The principle of the proposed bill aligns with existing efforts to refresh our maternity strategy, which is being led by Perinatal Services BC in collaboration with stakeholders across the province. This strategy will include actionable steps to improve perinatal and postnatal mental health services and ensure that all British Columbians receive the care and support they deserve. We also recognize the importance of ongoing consultation in this process. The voices of perinatal and postnatal healthcare providers, mental health professionals, Indigenous communities, advocacy organizations, and individuals with lived experiences must be at the forefront of shaping our approach. As we continue to refine and strengthen our maternity care services, we remain committed to reducing stigma, increasing awareness, and improving access to compassionate, trauma-informed mental health support for new and expectant parents. In conclusion, I agree with the importance of perinatal and postnatal mental health. Our government is committed to ensuring that the necessary supports are in place and the work already underway continues to build a stronger, more inclusive system for all families in British Columbia. Thank you.